Mr. Chairman, the indifference of so many extremist Republicans to the right to life of so many American women is truly shocking. Step by step, Republicans today continue their long-sought goal of a national ban on abortion, the type of ban that is already jeopardizing the health of so many Texas women, some of whom have had to flee the state of Texas in order to get medically essential care. In Texas, women like Kate Cox are among the many Texans who have been forced to travel hundreds of miles to save their right to life. Faced with the devastating news that her unborn daughter would not live and Kate's own health and fertility were at risk if she continued her pregnancy, a Texas court ignored her doctors and denied her any emergency abortion. For Austinite Amanda Zarowski, who also received the crushing news of a non-viable pregnancy that threatened her life, she was forced to linger on until the brink of death with sepsis infection before she could receive necessary medical care. In just the first 6 months of last year, nearly 100,000 women across the nation were forced to flee their states to receive an abortion. How many were unable to travel? How many of those death certificates should really list a Republican abortion ban as the true cause of death? There are no real exceptions to these draconian bans. Indeed, Texas courts have not only issued orders denying care of individuals like Kate and Amanda, the Fifth Circuit has now said that Texas can violate federal law and deny all emergency abortions. For the healthcare providers who want to offer the best medical care and practice in accordance with their professional training and judgment, Texas Republicans have placed a bounty on them. Whether you are a doctor or a counselor or even a taxi driver, anyone who assists a patient seeking an abortion may face vigilante justice in Texas. With doctors intimidated out of giving necessary medical advice, women are being denied care under heart-wrenching circumstances like what happened to Kate and Amanda. Maternal and infant mortality rates, which were already bad in Texas compared to other states, they're getting even worse. Medical professionals, many are fleeing the state of Texas themselves and choosing to practice in a state where they can use all of the tools available through their professional medical education. Meanwhile, Republicans continue their march to eliminate freedom everywhere in all 50 states. Abandoning years of bipartisan tradition on essential legislation to keep our government operated and funded, we have Republicans now that are insisting upon dangerous provisions to eliminate the very few remaining protections, overturning science-based decisions by the Food and Drug Administration to permit mail order for medication abortion, abandoning service women when they need necessary medical care, and eliminating Title X funding, all on a path to criminalizing abortion everywhere. Under this particular bill, Republicans now also seek to waste taxpayer dollars on what are clearly, by the definition of the bill, anti-choice propaganda centers, disguised as pregnancy crisis centers, posing as healthcare facilities with intake forms, medical jargon, staff in scrubs. Most of these centers do not have a single licensed medical professional or staff member. They rely instead on anti-abortion care propaganda and misinformation to discourage vulnerable women that are facing some of the toughest economic and healthcare decisions that they may ever make. These centers do themselves not protect patients, but they endanger them. They're a sham, and they should have no right to taxpayer dollars. For every Texan that is being offered fewer rights today than their grandmothers enjoyed, for every expectant parent whose life is threatened by Republican interference, I strongly oppose this bill, and I yield back.